new grad OTs. My name is Kyla Halverson. I am a recruiter within the Allied Division at AMN Healthcare. I staff new grad OT therapists in all 50 states, but today we will be talking about your first role as a new grad OT. Your first year as a new grad occupational therapist looks like a lot of growth for you as an individual. So you can, experience different settings, stay in a setting you did a clinical in. There are just so many opportunities as a new grad for you to learn and grow, and it helps you in the real world while you are treating clinicians. The mindset a first-year new grad occupational therapist should bring is just being flexible and open-minded, but also know you're not going to know everything in the beginning, and that is totally okay. Give yourself grace. Learn to slow down if you need to, but if you can do that, you will set yourself up for success your first 12 months. New grad mentorship is pivotal in any new grad occupational therapist career starting off, and it's easier for a new grad to come in, have somebody they can bounce ideas off of that has at least a few years experience underneath their belt in different settings, so that way if you're going into a setting that you don't have experience in a clinical, you can talk to them and get some ideas on maybe how to treat a patient or what you're seeing, and it will just help a new grad feel more at ease. Some common settings that new grads typically go into are going to be a school setting, a skilled nursing facility, a hospital, acute care, inpatient rehab. There's some outpatient and some peds in there as well. I would say new grads typically have more success in schools. There's usually additional support in the school on site, which is helpful for new grads, as well as skilled nursing facilities are also a great option too. A new grad starts shaping their career from day one just by being a sponge and taking it all in. Not getting too overwhelmed from the beginning, which you will do unintentionally, but you can, just take it all in, breathe when you need to breathe, take a break, and just make sure that you take advice from your peers internally at the facility you're at, as well as any mentor you have virtually, any professors you've talked to in the past, any peers that students you went to school with, and just be able to be a sponge and take it all in. It's totally normal to be nervous, but at the same time, take notes when you need to, take a walk outside on a break, but also remember your hobbies. If you like to work out. If you like to run, make sure you're doing that a few times a week. Meal prep during Sunday night to get you started for the week. Just do those things you would do while you're in school in the beginning of your career, and that will help you in the long run set boundaries with yourself and prioritize work-life balance as well. Routines and habits that help new grads their first year are really personal to that person. So whether you work out on a daily or weekly basis, make sure you're still doing that. If you run every day or you go hit the gym and hit weights, make sure you're taking care of yourself and prioritizing yourself within your first job. And that will just help you set yourself up for success so you don't get as overwhelmed your first week or 13-week contract. AMN Healthcare supports new grad OTs through our new grad mentorship program. So for the first 2 years of contract, she'll have a experienced OT that's worked for AMN for at least 3 years as your mentor virtually. So you can email them if you have any questions, you can text them, and you build a connection with them through those first 2 years. They typically have experience in multiple settings, which helps you going into any setting you might go into in a travel contract. But also you have a clinical team with AMN that will help as additional support while you're on assignment. Our credentialing and your recruiter as well will walk you along the whole process from start to finish, from submitting to jobs, getting your profile ready, but also while you're on assignment, making sure you feel supported as well. And I think that's why AMN Healthcare stands out. In your first year as a new grad OT, just being moldable but taking it all in. You're not going to know everything when you first start, but also just being able to try different settings, figure out where you belong and what what you like and love to do in what settings. You might work in 2 clinicals in school, but that's just 2 different settings you possibly worked in. And that's the great thing about travel in your first year is you can, try 4 different settings and know that maybe something you didn't do in school you actually love, in your career. My hot tip for a new grad OT starting your journey is just remember whenever you start interviewing with facilities, know that they're interviewing you just as much as you should interview them. Ask about patient caseload, ask about productivity, ask, what your schedule is like, if there's any weekend availability to work or any flex in days to have an additional day off during the week to go explore. These are all good questions to ask just to make sure that they're a good fit for you just as much as you're a good fit for them. Whenever you are ready to start your journey as a new grad OT with AMN Healthcare, reach out to me for any additional questions and we can get you started today.